Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rouleau.
Serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit.
The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau. Welcome back to the only patient safety radio program in the world that doesn't mince words, doesn't fear the truth, and doesn't stop where mainstream media ends. And I'm glad you're here. If you tuned in last week, you'll remember our topic about pets, and I want to make sure that I clarify a few things. First, I'm not anti-vaccine for your pets. I am pro-education. As with all things, I simply know that we must make decisions for ourselves and our pets based on our own research and conclusions, not on the wisdom of the decade or what is taught by those holding the purse strings. Just be mindful, with eyes open and your list of questions in hand, before you line up and sign up for anything. Next, I want to be sure that I correct my enunciation of the word veterinarian. I do know that it is a 6-syllable word and not 4 or 5 syllables. However, perhaps in my excitement of the topic, I may have slurred the second syllable into the third, thus sounding like veterinarian, when in fact, had I been more precise, I would have pronounced it veterinarian. I was taken to task on that by a loyal listener, and I appreciate the reminder. Having been an ardent Latin student, I do love words and their origin. Veterinarian, from the 1640s, from Latin veterinarius, of or having to do with beasts of burden. All right. Well, today, as promised, our guest is going to share her misadventure with an antibiotic called Cipro and how that has caused her to become a fierce advocate for education regarding antibiotics. And I couldn't agree more. So let's get ready to tackle today's timely topic, because right now it's time for the healthcare hazard of the week.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare and hospital safety snippet just for you. Here's our expert, Pat Rouleau.
Do you really have the flu? Coughing, aching, feverish, sore throat? Oh no, it's the flu. Right? I mean, it is flu season, whatever that means. So if you have symptoms that sound like the flu and it's the right season, then you must have the flu. So you go to your doctor, and yep, a quick look and off you go with a nice prescription for an antibiotic. Oh heck, throw in some Tamiflu too. Has this happened to you? Well, it happened to me a few years ago when I was having some amazingly horrible throat symptoms that ultimately ended out to be a case of acid reflux. But meantime, a visit to my doctor sent me on my merry way with a prescription for Cipro, an antibiotic in the fluoroquinolone family that is used to treat bacterial infections. Cipro, and all other antibiotics for that matter, only treat bacterial infections, not viral infections, such as the common cold. So, how did my doctor know that I had a bacterial infection? He didn't. It was flu season. He was swamped with sick people in his office, and I exhibited some flu-type symptoms. Flu, next. Flu, next. Flu, next. So home I went, giving the side effect insert a quick look. Who could read that multi-folded page anyway? Tiny writing, words I didn't understand? Plus, I was sick. I didn't feel well, and reading fine script was not on my radar that day. Too bad I didn't, because Cipro can be quite ototoxic, which means toxic to the ear. Many healthcare professionals know little or nothing about ototoxic drugs. Therefore, it's up to you to do all you can to protect your ears from the ravages of these drugs, and many drugs other than Cipro can cause damage to your ears. This can be especially important to those who already have some level of hearing loss. Cipro can cause severe hearing loss, loud tinnitus, or is it tinnitus? Better look that one up. Dizziness and ear pain. I know that now after 3 solid years of ear ringing. Only after the fact did I know that Cipro also carries what is called a black box warning. The Food and Drug Administration imposed the government's most urgent safety warning on Cipro, Levaquin, Avalox, and many other fluoroquinolone antibiotics. The FDA requires a prominent black box warning, and in this case, the black box warning warns of an increased risk of tendinitis and tendon rupture. Well, 3 days into taking Cipro, my right ear began to ring, buzz, hiss, squeal, to the point that I called the doctor to complain of this, and he said, no, the Cipro shouldn't do that. Well, he was right. It shouldn't, but it did, and it does. Interesting way to phrase that. So his comment couldn't be taken as a truth. He didn't say Cipro doesn't do that, but rather shouldn't. So he said discontinue that and prescribed Zithromax, the ever-popular Z-Pak. Well, according to an article by Dr. Rodney Rode from Texas State University, he writes, why won't physicians order laboratory tests to confirm, or at the very least, increase the odds that they are treating the right infection with the correct medication via the use of a screening test? Of course, there are numerous reasons to not order a test. In my scenario, the physician is absolutely correct that we were in the midst of flu season. However, symptoms from allergens, cold viruses, and other microbes can easily be mistaken for a flu. In fact, Dr. Rhodes says even Ebola can mimic flu early in the infection. The use of antibiotics without a confirmed diagnosis of a bacterial infection is one of the leading pillars in the deadly increase of antibiotic-resistant infections, including healthcare-associated infections like MRSA, methicillin, that's the antibiotic, methicillin-resistant Staphylococcus aureus, MRSA. We talked about that on the show before. And just by the way, C. diff, Clostridium difficile-associated diarrhea, is a serious adverse effect of Cipro and other fluoroquinolones. Actually, all antibiotics are culprits to a certain extent. Well, now Dr. Rode further states, and this is huge, physicians should always order an ID, an antibiotic susceptibility test, when confirming a bacterial infection. Of course, in a life and death situation, one may have to prescribe an antibiotic without the use of a laboratory confirmation, but it should only be in those critical situations. Now, he is coming right out and saying what we've been saying for years on this program. If our healthcare providers are not going to provide healthcare in a mindful and responsible manner, then we, the patient, should take what we know to be true, to be educated and empowered to ask for a laboratory-confirmed diagnosis instead of simply settling for what the doctor gives us. And if you're afraid to question your doctor, if you're too scared to ask the question, how do you know it's a bacterial infection? To which the answer can never be 100% certain. I mean, a doctor is trained, but cannot tell by looking with 100% positivity that you have a bacterial infection versus a virus. They cannot tell that without a laboratory-confirmed diagnosis. If you cannot ask, then bring someone with you. Or, if you're going alone, write it on a piece of paper ahead of time and hand it to your doctor that says, I'd like to know for sure. Please order a lab test before I take this drug. As I discussed about the fluoroquinolone family of antibiotics, and I'm sure today's guest will emphasize, these antibiotics should be used only when the patient faces a potential fatal outcome and only after the use of other antibiotics have been ruled out. This is not due to the probability of risk, but rather the severity. Take all antibiotics with great care. The prefix anti means against. Bios comes from a Greek word that means life. So an antibiotic is against life. And when you take them, they do not discriminate in destroying all in their path, the bad guys and the good guys, leaving you with a deafening host of potential life-changing effects. Use them when needed and with a confirmed laboratory-tested diagnosis. So do you really have the flu? Next time, be sure you know the answer before you take something that's against life. And with that, let's hear some legal news you can use. Let's spend the next minute with our friends at Schrath & King. They always have the answers. Well, David, Emily in Illyria wrote, "Can I still make my own healthcare decisions once I have created an advance directive?"
Absolutely. When a healthcare directive is executed, while it goes into effect immediately, the individual signing that directive retains control over their own healthcare decisions. The document is intended to enable an agent to make decisions when and only when the individual signing it is not able to make those decisions for themselves.
And if our listeners have more questions, where can they find you?
We can be reached by telephone at 440-585-1600, 440-585-1600.
Great advice. Thank you for taking the time to help us today.
You're welcome, Pat.
They're conveniently located on Som Center Road in Willoughby Hills, just south of Route 6. Or you can always visit them online at schrathking.com.
Dealing with my father's illness was full of difficult decisions. Hospice of the Western Reserve gave me the peace of mind that I made the right choice.
Discover why the hospice of choice is Hospice of the Western Reserve at hospiceofchoice.org.
If you know me, you know that I'm concerned about healthcare-acquired infections. Stethoscopes have long been associated with the transmission of healthcare-related bacterial infections, and studies have shown that stethoscopes carry harmful bacteria such as staph. To eliminate the infection risk, doctors simply need to wipe their stethoscopes with a disinfectant swab after use on each patient. Despite this, a report in the American Journal of Infection Control makes it clear that providers do not heed the warnings, concluding that doctors must routinely disinfect their stethoscopes before and after each patient contact. There is, however, a viable alternative to the disinfectant cloth or wipe. Clean Stethoscope, offered through a company called Cleanant, is a device that enables doctors, nurses, or any healthcare practitioner to both protect and clean their stethoscope with the greatest of ease. By sliding the bell of the stethoscope into the Clean Stethoscope chamber, doctors can examine multiple patients without putting themselves or their patients at risk of healthcare-acquired infections. If you're a healthcare provider or if you're a patient, check out Cleanant.com. Cleanint, Cleanant.com. And patients or family members, tell your doctor about Cleanant and ask that their practice include the Clean Stethoscope from Cleanant. Call 888-715-0464. That's 888-715-0464.
Hot. Bring the heat.
And now, back to the show.
You are listening to Speak Up and Stay Alive Patient Safety Radio, and I am your hostess, Pat Rouleau, always keeping a sharp eye out for a topic and guest that tend to get bypassed by mainstream media. And so it is with today's guest. She is Lisa Bloomquist, a patient advocate who was injured by the antibiotic called Cipro in 2011. She runs the fluoroquinolone toxicity syndrome advocacy site called floxyhope.com and manages the fluoroquinolone wall of pain. And these are websites to give hope for healing to those adversely affected by fluoroquinolone antibiotics such as Cipro, Levaquin, Avalox, and Floxin. Lisa is a guest blogger for HormonesMatter.com and CollectiveEvolution.com. She is the host of the Floxy Hope podcast. And Lisa has vowed to continue to scream about the dangers of fluoroquinolone antibiotics until those in the medical profession start paying attention to their Hippocratic oath, establish proper informed consent for administration of these drugs, and stop giving them to children. She has a bachelor's in economics from Colorado State University and a master's in public administration from University of Colorado in Denver. She is a Colorado native who enjoys the mountains, Pilates, and her cat. And we have a lot in common, both damaged by Cipro, love the mountains, and our cats. So a very welcome to the show, Lisa.
Thank you so much for having me, Pat.
Well, it's our pleasure, our pleasure. Now, before we get into your story, explain so that our listening audience understands, what is the name fluoroquinolone? What is that?
Fluoroquinolones are a class of antibiotics, and they are very powerful broad-spectrum antibiotics. The most popular ones in America are Cipro. The generic name for Cipro is ciprofloxacin, Levaquin, which is levofloxacin, Avelox, which is moxifloxacin, and Floxin, which is ofloxacin. And you'll notice that all of those generic names have the word flox in them, F-L-O-X. And so people who have been hurt by fluoroquinolone antibiotics started to call themselves floxy. So if you ever hear the term floxy or floxed, it comes from that root word in the antibiotic names, in the generic names. They are used for urinary tract infections, sinus infections, sometimes pneumonia, anthrax, syphilis. It's appropriate for them to be used for incredibly difficult to treat infections. When no other sort of antibiotic will help you, it's appropriate to use these drugs. They disrupt the DNA and RNA replication cycle for bacterial DNA. And they also disrupt the DNA and RNA replication cycle for mitochondria within human cells. So disrupting the DNA and RNA replication cycle for our bacteria is also it's a very dangerous thing to do. And so these drugs really should be preserved for life or death situations, and they should only be used in those situations like anthrax. Except honestly, for anthrax, doxycycline works as well. But unfortunately, rather than preserving these drugs for very serious and life-threatening infections, they're really being given out like candy. About 26 million prescriptions for fluoroquinolones were given out in America in 2011 alone. But around 25 million prescriptions a year for these drugs, which means that they are massively overused. The side effects from these drugs, if you look at any of the warning labels, they're pages and pages long. The Cipro warning label is about 43 pages long with side effects that are, well, goodness, name anything just about, and you'll see it as a side effect, which honestly kind of makes people go a little bit numb when they see that absolutely everything can go wrong, except truly everything can go wrong in your body if you experience fluoroquinolone toxicity. There is a black box warning on all of the fluoroquinolones, and the black box warning is the most severe warning the FDA puts on drugs. So it's the heaviest warning before they take the drugs off of the market. It's a very serious warning. What they don't tell you is that every single tendon in your body can be weakened. You can rupture a tendon while getting out of bed, not only while you're on these drugs, but after you've taken these drugs. And I think that that's what most people don't realize is that the tendons can be permanently damaged. So you can have tendinitis, or you could rupture an Achilles months after you take these drugs as a side effect of these drugs. The other side effects include peripheral neuropathy. An increased warning was just added to the warning label for permanent peripheral neuropathy, burning, stabbing, aching feelings, muscle twitches, kind of vibrating in your muscles, cracking joints, all sorts of musculoskeletal issues. Eye floaters, hot and cold sensations, feeling numb, feeling like there's electric shocks shooting up and down your spine, a lot of central nervous system issues, loss of memory, loss of reading comprehension, loss of mental capacity and mental capability. There have even been people who have seen lesions on their brains in brain scans after experiencing fluoroquinolone toxicity. Before I kind of just overwhelm the audience completely with listing any more symptoms. It's just really summed up as multi-symptom chronic disease is what these antibiotics can cause. And that's an awfully heavy price to pay for treating a suspected sinus infection.
When you said that they eradicate the bacteria by interfering with DNA replication, so they kind of work like a chemotherapy drug where they disrupt the DNA and destroy the cells. And all you have to do is type fluoroquinolone antibiotic in a search engine, and the entire page is filled with negative press. So you can't make this stuff up.
Yeah, and absolutely. And sorry for interrupting, Pat, but you touched on something that I really want to drive home to the audience, that they're a chemotherapy drug. And truly, these drugs are being used to treat cancers. But just be aware that when you're taking this drug for a urinary tract infection, it is a chemotherapy drug. And it's not appropriate to be taking chemotherapy drugs or to be prescribing chemotherapy drugs for urinary tract infections. It's just not appropriate. The consequences of these drugs are very much along the same lines as how chemotherapy drugs work. So I think kind of when conceptualizing these problems with these drugs, it's very important to think of them as chemo drugs instead of thinking of them as simple antibiotics, because they are much more similar in their effects and even their mechanism of action to chemo drugs than they are to penicillin.
Wow. So now, if you would, though, Lisa, tell us about the event that triggered your reaction to Cipro and then consequently your patient advocacy.
So back in 2011, I was 32 years old, and let me just tell you real quick about how active I was. I was going to the gym 5 to 7 days a week. I was testing out CrossFit gyms. I had hiked entire 500-mile Colorado Trail right before in the summer of 2010. I was incredibly active and athletic. But anyhow, I had a urinary tract infection, and I took Cipro. About a few days after I took the Cipro, I took it for 3 days. And actually, I'm sorry, let me rewind a little bit as well and say that I had taken Cipro in 2009 with really no ill effects. Like looking back on things now, I noticed I can realize that I had kind of a twitchy eyelid and some weird GI issues that kind of waxed and waned, but really nothing horrible happened to me in 2009. It was the second time that I took Cipro in 2011 that really the bomb went off in my body. But basically what happened is I took the full course, and then a few days later I started to get floaters in my eyes, like big black floaters would just go into my vision. So I went into the doctor, and they looked at my eyes, and they said, no, well, everything looks okay. So I continued on with my life for a few more days, and then I started to get menstrual cramps. I was getting my period, and I started to take Advil and NSAID. And then after, I don't know, maybe a day of taking Advil and also my hormones going wild, everything went wrong in my body. Suddenly, I couldn't walk anymore. My hands and feet swelled up, and they were incredibly painful to use. Suddenly, my feet hurt so incredibly bad, I could barely move. I had hives all over my body, and especially in my joints, like big, red, angry welts. And I'm actually somewhat thankful for those big, angry welts, because when I went into the doctor, they couldn't say, well, nothing is wrong with you. Instead, they said, I don't know what's wrong with you, which is true. They didn't really know what was wrong with me. I went into the doctor going, what in the world is going on? Why can't I walk? Why can't I move? Why do my hands hurt? Why do my feet hurt? And why do I have these hives all over my body? And they ran all sorts of blood tests and couldn't give me an answer. They could tell me that nothing was coming up on the blood test. All of my blood work, the basic blood work, came back normal. And they said, as far as we can tell, you're fine. I said, well, I'm not fine. There's nothing fine about me. And I ended up seeking some alternative treatments through acupuncture and supplements and things kind of along those lines. After that, things continued to get worse. My hives and my mobility got worse and worse for a little while, probably a couple of months. After a couple of months, I lost a lot of my memory. I lost my reading comprehension. I lost my concentration. And really, the mental symptoms were some of the scariest for me. I very much lost my sense of self. I lost my motivation. I lost my caring about things. I really felt like I had difficulty connecting with people. And frankly, I was terrified. I had a huge amount of anxiety, and it slowly started to get better. But I did not get back to what I would consider to be about 95% better for 18 months.
Wow.
So it really took away 18 months of my physical and mental life.
Wow. This is quite a story and quite a comeback story. And like so many of the guests on our program that are affected by something and then decide to speak up against it and about it and for it. And so I'm really proud that you've been able to do that. And I want to encourage our folks again, the fluoroquinolone Wall of Pain is fqwallofpain.com, fqwallofpain.com, and that's where they can find stories from others. It's always helpful to hear what others have to say, especially if you're in the same boat. And I was noticing and thinking about this, that the rise of these potent drugs has also been blamed for increases in two very serious, hard-to-treat infections, and we talk about this on the program quite a bit: antibiotic-resistant Staphylococcus aureus, better known as MRSA, and the severe diarrhea caused by C. diff. In fact, one study found that these fluoroquinolones were responsible for about 55% of C. diff infections at a very specific hospital. And I think this is important to note for those patients in the hospital, and why it's of supreme importance to at least ask everyone to wash their hands before they touch you, because you don't want to have to take antibiotics in the hospital if you don't have to. And so I guess that leads me to the question, as a patient, how can we decide if taking the antibiotic is worth the risk, or if it's important to cure our ailment? I mean, we don't want to refuse something that will help us, but are certain people more susceptible to a negative reaction?
Let me answer that in kind of two separate pieces. I think that fluoroquinolones should not be prescribed unless all other possibilities have been exhausted. So there are other antibiotics available that are safer. No antibiotic is without some side effects, except the side effects for fluoroquinolones is particularly severe, especially given the fact that they can be permanent. And most of the other antibiotics out there, the doxycyclines, the penicillins, the amoxicillin, cephalosporin, the other antibiotics out there, yes, they have side effects, except they are usually more passing side effects instead of something that can plague you for years or even permanently. And so, kind of given the severity of the adverse effects of fluoroquinolones, I really think that people should not take them unless there is no other option.
Okay.
And I understand that there are some cases where there is no other option, and you need to play Russian roulette. But there are plenty of options that I think people don't necessarily think about. Not sure if you're familiar or not, Pat, because we didn't talk about it, but fecal transplants have shown to be incredibly effective against C. diff. So much more effective than the current general practice of just wiping out all the bacteria in someone's gut with additional antibiotics. You know, like it's very much the current practice for C. diff is try to fight fire by throwing gasoline on it, and sometimes that works. Sometimes you throw enough gasoline on the fire, it gets it wet enough. But for the most part, it's a very foolish way of thinking about things.
Right. We need to use extreme caution, and when our doctor prescribes an antibiotic, what conversation should we be having then with our doctor about any antibiotic, but especially these?
I think that it's incredibly important to get your infection cultured. There are just way too many people out there getting antibiotics when they have either a viral infection or they have a persistent cough that they think is bacterial in nature, but it's really acid reflux, or they think that they have a urinary tract infection, but it's really inflammation. It's very, very, very important to make sure that what you have is a bacterial infection before you take any sort of antibiotics. And then after a culture is done, it should be apparent which antibiotics will work on the infection. Penicillin and amoxicillin tends to be pretty benign. Most people who have been affected by fluoroquinolone toxicity do fine with Z-Paks and do fine with doxycycline and tetracycline. Anything in the cephalosporin class seems to be fairly well tolerated. It's not something that should be taken lightly, and we take them just way too lightly. But I really want to emphasize that fluoroquinolones are chemo drugs,
Right.
masquerading as antibiotics.
Absolutely, and I like your advice that your infection should be cultured. That's what happened to me. I was having acid reflux, and it caused my throat to be sore and red, and just looked at me and gave me Cipro, and we didn't even culture that. So bad me, but never again. I read in 2010 Levaquin was the best-selling antibiotic in the United States, but it was also the subject of more than 2,000 lawsuits from patients who had suffered severe reactions after taking it. So help us, what is the situation with lawsuits?
Yeah, people definitely deserve some justice. People are really caught in a horrible catch-22. If a symptom that they experience is listed on the warning label, then most lawyers won't take the case because they can't sue the drug companies for failure to warn. Even if you experience all of the symptoms that are listed on the warning label at once, even if you can say, like, well, it doesn't say that this would be permanent. It didn't say that it would be this severe. Most attorneys are not taking the cases. Like I said, there's a black box warning on the label for tendon ruptures, except if you have multiple tendon ruptures, you can't sue. It's very difficult to sue, basically, because lawyers aren't taking cases. But if your symptom that you experience isn't listed on the warning label, then they say, well, it's probably not from the drug.
Right.
And so there's this really horrible situation of a lack of acknowledgement and a lack of justice.
Wow, and that's why Cipro has 42 pages of side effects. I mean, it's like, we warned you.
And so they kind of cover their butt
Yep.
by warning for pretty close to everything.
Yep.
And you can see that on a lot of dangerous drugs out there, that there's just warning label creep. And those warning labels, you think that they're to protect the consumers, but they're really to protect the pharmaceutical companies.
Absolutely, and let's bring that out, I mean, because that's what it's all about.
There was a change to the warning label recently, adding permanent peripheral neuropathy to the warning label. And so there are some law firms that are working on fluoroquinolone toxicity lawsuits right now. And if anyone who's listening would like to get some information on those lawsuits, I suggest that you contact the Quinolone Vigilance Foundation, and their website is saferpills.org. Fortunately, people who are hurt by a generic drug cannot sue, thanks to our Supreme Court that in about a year and a half ago decided that it was wise to take justice away from everyone who takes generic drugs. So the only people who are eligible for these lawsuits, these peripheral neuropathy lawsuits, are people who took the name brand drugs made by either Bayer or Johnson & Johnson. So Bayer is the one who makes Cipro and Avalox, and Johnson & Johnson makes Levaquin. And personally, I took generic ciprofloxacin, and I'm not eligible for any sort of compensation. Really, for the highest court in our nation to take even the possibility of justice away from people who took generic drugs, it's disgusting, and the repercussions of it are absolutely horrible. It doesn't really seem like there's enough anger out over the fact that you cannot gain justice if you are hurt by a generic drug. But all of our insurance companies force us to take generic drugs in a lot of cases.
Thank you. As you're speaking, I'm thinking, we talked about this on the show maybe 2 years ago, and I'm going to have to revisit it as well. Yeah, to take away any shred of justice that we might gather, here we are forced to take generic drugs by our insurance companies, yet if we've got an adverse effect caused by that generic drug, the law takes away any kind of recourse from us because generic drugs are protected. So we are caught in a bad situation there that we need to start to speak up about, and I'm going to join you with that as well.
Yeah, thank you, Pat. And it really takes away kind of one of the checks and balances on the pharmaceutical industry. The pharmaceutical industry is so incredibly powerful, just so incredibly well funded, and they enjoy a really good reputation, which is very strange. Like people assume that the pharmaceutical companies are just out there to create drugs and save lives, except they kill an inordinate number of people. I mean, I've heard as high as the third leading cause of death in America. And why a company that creates something that kills this many people enjoys a good reputation is completely beyond me.
Yeah, they're well funded and they're well connected and they're tied to our regulatory system. And we have no recourse as people unless we decide that we need recourse and band together and speak up. And that's the only way to affect a change.
You got it. Yep. Because these systems are working together.
So I was thrilled when I saw that you have a website called floxypets.com. So if these antibiotics are bad for us, the same for our pets, right?
Absolutely. And it breaks my heart when I think of cats and dogs and horses and any sort of pets going through fluoroquinolone toxicity because they have absolutely no idea what hit them. To do this to an animal or a child that really can't understand on any reasonable level what happened to them, it breaks my heart.
Yes. As it should. These little pets and little people have no choice and no voice, so it's up to us to make wise and informed decisions.
Yeah. And just kind of mentioning children, these drugs are generally thought of as being contraindicated in the pediatric population. And then also something to be very careful of is topical application.
Okay.
So ear and eye drops are a huge way that children get exposed to fluoroquinolone. So many babies have ear infections. The number of kids who are given Cipro ear drops.
Okay, that's a whole other topic here, huh?
It is.
Yes.
It is.
Oh my.
And these kids end up having health problems, and the parents don't put together the pieces because the doctors aren't putting together the pieces, and no one is figuring out why these kids are sick. It's really horrible.
Yes, it is, and there's obviously so much more that we need to know about this.
Just know that there is a community out there, and that there are people who get through it, and there are people who are advocating, and there is advice and there is help, and please hang in there. And I know it's easier said than done, but just kind of hang in there.
So we want people to pay attention to this. They can get more information at your website called floxyhope.com. Lisa, what a pleasure to have met you, and I'm so proud for what you do and what you're doing to help others with this very little discussed subject. And so hopefully you and I can continue this conversation and get more awareness out there. So thank you so much.
Well, thank you for having me, Pat. I appreciate the opportunity.
It's our pleasure. And folks, just to summarize, when an antibiotic is prescribed, please, it's wise to ask what the drug is, whether it's necessary, what the side effects are, what should you be looking out for, whether they are effective alternatives, and when to expect the diagnosed condition to resolve, and what to do and who to call if something unexpected happens or if recovery seems delayed. And keep this conversation in mind today. And in the meantime, study up and visit the website floxyhope.com. Again, Lisa, thank you so much.
Thank you, Pat.
Tired of the same old presentations?
Can you forward to slide 38, please?
Are you looking for a new, out-of-the-box topic for your next event? Want your group to leave inspired, informed, and satisfied? No PowerPoint presentations and dim lights here. No snoring or snoozing goes on during Pat's presentations. To help your entire group, organization, business, or church stay safe during any healthcare or hospital experience, invite Pat to speak. Her presentation formats vary from 15-minute small talks to 30-minute lunch and learns, to 1-hour events called The Scoop, to full days. Pick a topic from her website or request your own. Visit her website, speakupandstayalive.com, or call Pat to discuss how she can make your next event fun, enlightening, and life-saving. Want testimonials? Go to the bulletin board link at the website for color pictures and comments from real people. Again, it's speakupandstayalive.com or call 440-725-5462. That's 440-725-5462.
You're listening to Speak Up and Stay Alive Radio. I am your hostess, Pat Rouleau. So happy to spend this hour with you to help you survive any healthcare or hospital encounter. Well, today the boys decided to get back to our roots, and that could only mean one thing.
Fear the wheelchair.
Oh, well, in case you don't remember, Here's why our game has such a crazy name. By now, you've probably heard me talk about how I fear the wheelchairs that grace the front doors of almost every hospital. Patients and visitors get out of their cars and hop into the wheelchair, and I always wonder, where have they been? What have they touched? When was the last time those jeans were washed? Well, then they wheel around the hospital, use the bathroom, sit in waiting rooms, visit patients, all the while picking up additional and deadly hospital bacteria like MRSA, C. diff, a bit of E. coli, and perhaps some candida yeast. And at the end of the day, they're back in their cars, leaving the contaminated wheelchair at the front door of the hospital, ready for the next person to climb aboard. Well, this makes the wheelchair a high-touch, highly contaminated vehicle capable of spreading infections all over the place. So the wheelchair is now this show's representation of all hospital dangers, kind of like our mascot. So here we go, the revival of everyone's favorite game show of all time,
Fear the Wheelchair.
Listen as Joe reads some right or wrong statements. Then, even though I can't hear you, shout out your answers along with Bob. Is the statement right? Or is it wrong? All right, Joe, are you ready?
Yes, I am, finally. All right, here we go. Right or wrong? Here's a restroomology question. Bathroom stalls on the right side are cleaner than the stalls located on the left.
What do you think about that, Bob?
Think about it. Maybe it's right.
Oh, no, that is wrong. Bob, most people are right-handed and tend to gravitate to the right-handed stalls. So if you enter a restroom and that has stalls on the left and the right, which one are you going to choose?
Left.
Yes, that's important stuff, Bob.
Right or wrong? Going beyond the ask button means healthcare providers should offer patients a way to learn about hospital hazards and then allow them to speak up without fear.
What do you think about that, Bobby?
I think that's true.
Yes, it is true. That is right. And I'm hoping that some hospitals and healthcare facilities will take advantage of my PEP talks. And that stands for patient engagement programs, or patient empowerment programs, or patient experience programs, whatever you want to call it. But I believe that by educating patients and then allowing them to use that knowledge without fear, that hospitals can improve their patient satisfaction scores and patients will have a better and safer experience. What do you think of that, Joe?
Sounds good to me.
You got it.
Right or wrong? If you're going to the hospital for any type of surgery, ask to be tested for MRSA.
What do you think, Bobby?
That is definitely right.
Yes, that is right. Anyone who is considered an at-risk patient should request a nasal MRSA screening.
Right or wrong? When researching symptoms on the internet, believe everything you read. If it's in writing, then it must be true.
What do you think, Bob?
Well, that's wrong.
Yes, that's obviously wrong. But you know what? You'd be surprised how many folks tend to think that way. Research several different sites, check to see who's funding the site, make sure they're simply not in the business to sell wonder drugs or overnight cures. The bottom line, be a detective. Uncover every source that you can, compare and check with your healthcare provider.
All right or wrong? If you don't see any bleach wipes in your hospital room, just dust your bed tray with a napkin or paper towel.
Oh, what do you think, Bob?
That's definitely wrong.
Of course that's wrong. Ask the hospital staff for a canister of bleach wipes, put on a pair of gloves, and clean every high-touch item in your room using one bleach wipe per surface. I do this several times each day, just as a precaution.
Right or wrong? 40% of tray tables on the airplanes are contaminated with MRSA.
What do you think, Bob?
That's a little high. Maybe that's wrong.
Ooh, sadly, that statement is right. Here's what I do whenever I fly. I bring a baggie of bleach wipes and I wipe down the seat and the seat belt and the tray tapes. With turnaround times as fast as they are, nothing is cleaned, let alone sanitized. And what's interesting is the person sitting next to me or across from me always asks to borrow some of my wipes.
Oh, bring hand sanitizer.
You think I should bring that as well? Do you remember that time that, I guess the cabin pressurized my bottle of hand sanitizer, and when I opened the lid, the gel squirted all over the pants on the guy next to me.
It was sort of embarrassing.
It was crazy.
Right or wrong? The word antibiotic means against life.
What do you think about that, Bobby?
It's definitely against life.
You've heard way too many of my presentations, haven't you?
Oh, yeah. I could probably quote them verbatim.
Well, let's not go there. Actually, anti means against. And bios is a Greek prefix that means life. So when you take an antibiotic, it destroys all the bad life and the good life, leaving you at risk. So I suggest to take a probiotic. I take one every day. Do you, Joe?
No, but I'm trying to eat more yogurt.
That's right. You eat more yogurt.
Yeah.
That's good. That's healthy for you. Pro means for, bios means life, so a probiotic is for life. Joe knows what he's doing. And remember, guys, don't take antibiotics for any reason other than a bacterial infection, right?
That's correct.
You got it.
All right. Good boys.
Right or wrong, prior to any and every healthcare encounter, a good question to ask is, will it hurt?
What do you think, Bob?
That's a good question. I think that is a good question. I'd want to know if it hurts and I'd like to know all about it.
Oh, Bob, that's wrong.
Thank you.
But you know what? It is still a good question.
That's a very good question.
It really is a good question. But if you remember, one of our guests, she gave us some quick one-liner advice to our questions, and she couldn't stress enough that we asked the question, how much is that? Remember that?
Yes, I do.
Yeah. So if all patients asked that question, perhaps the veil of secrecy surrounding medical costs would be lifted.
That's a good way of answering it.
So first we'll ask how much is that, and then we'll ask if it hurts.
And then will it hurt my wallet, right?
There you go. That's what...
That's where the hurt comes in,
That's
Joe.
where the hurt comes. Your answer was right then, Bob.
You're right.
All right. We need a clap, right, Joe?
Sure. Real quick.
Yay, Bobby was right. Any more?
Yeah, one more. Right or wrong, want to be a good patient? Dig out those words, please and thank you.
What do you think, Bobby?
I definitely believe that you can get more attention that way if you ask and if you're very sincere about it.
Absolutely. That's right.
Oh, okay.
Actually, it's a beginning. I would also suggest that you ask for help. Would you please help me? I know you're busy, but will you help me understand the side effects of this medication? And then say, thank you. Thank you for helping me. Thank you for helping my mom. This is some powerful stuff, folks. Don't you guys think?
I definitely believe so.
Yeah, when I was in the hospital for that week, when I kept saying please and thank you, at first they were kind of jumped back and like, what you're saying please and thank you? But it actually did work.
Absolutely. See, take advice from Joe. Another way is to bring a list of questions to help you stand out and let your doctor stay on track and let them know that you have this list. And finally, really being a good patient isn't all that difficult. It starts with being informed and it ends with being polite. And by listening to this radio show every week, you are well on your way to be, you knew I was going to get there, right? You're well on your way to becoming informed. You want to be an even better patient, guys?
Go ahead.
And you both should be. Get a copy of my book, Speak Up and Stay Alive, Your Hospital Survival Guide. Not because I wrote it, but because you need it. It's easy to read. It has an in-your-face cover that when taken to the hospital with you and placed on your tray table, will cause everyone who comes in to ask what it's all about. This is a silent yet powerful way to let everyone know that you take being informed patient very seriously. Listen, guys, after the show and all you listeners, head over to the website Speak Up and Stay Alive to purchase the book. And if you do not have access to internet, you can call me and I will take your order over the phone. Lots of people do it that way. The number is 440-725-5462. Well, thank you guys for playing the most requested radio game show of all time. I'm almost certain.
Yeah.
And it's called
Fear the Wheelchair.
Yay! Don't go anywhere. There's so much more you can learn about healthcare and hospital safety on America's favorite show, Speak Up and Stay Alive, Radio. Well, folks, talking too much today and once again, short on time. So until next week, take some time and visit our newest internet radio station called the Speak Up Talk Radio Network. And you can find that at speakuptalkradio.com. Speakuptalkradio.com. We've been blessed to have added several new programs to the current lineup, and I just know you'll find something within those programs that will help you live a healthier and a happier life. We have Animal Talk Naturally, empowering you with unlearning to care for your animals naturally. Boil the Frog Slowly. Are politics hazardous to your health? This show goes where mainstream media stops. Health Talk, today's hottest health topics from a complementary perspective. Living in the psychic realm and psychics gone wild. Realty Universal Radio, a show about real estate, but also a show about empowering people and giving back. A new one, Taz and Paula Show, Embracing Mother Earth. The Gift of Choice. This inspirational hour provides information and motivation each week to help you live your dream and attain the health, happiness, and abundance you deserve. The Holistic Health Show, another new one. Avoid chronic illnesses and prescribed medications and overcome diseases naturally. The Janet Love Show focuses on empowerment, inspiration, and transformation on a variety of topics from health recovery, intuition, spirituality, and other specialty topics. Another new one, The Jen Royster Show, is an inspirational hour that explores the spiritual approach to life's challenges. The Vaccine Agenda, authoritative help with vaccine exemptions and waivers throughout the United States. Those Weekend Golf Guys, the voice of the average golfer. And of course, you can hear today's show on that network as well as several other wonderful programming. So please visit speakuptalkradio.com. speakuptalkradio.com. These shows air nonstop 24/7, all day and all night. So if you find yourself with nothing to do early in the morning, late at night, or while you're eating lunch, simply head over to speakuptalkradio.com. And now it is time to part, but we'll get together again next week. Same time, same place, but you know me, never the same information. Until then, I hope you have a healthy and a happy week, free from fluoroquinolones. I am Pat Rulo, and I am your guide to safe and successful healthcare and hospital encounters.
Listen to Pat Rulo and Speak Up and Stay Alive RadiOh. Stay safe from little-known healthcare and hospital hazards. To learn more, go to speakupandstayalive.com. That's speakupandstayalive.com.
I'm Jerry the Germ with a Speak Up and Stay Alive healthcare and hospital safety snippet just for you. Here's our expert, Pat Rulo.
Hey, Jerry. Healthcare costs are high enough without adding you to the mix. A hospital stay can affect not only the patient, but the patient's employer. Why? Because of reduced work performance and lost productivity, not to mention increased costs. So what can be done? Invite me to speak. I offer employees a fun way to understand healthcare and hospital dangers so they know how to get out of the hospital faster, how to avoid hazards such as secondary infections or drug side effects that prolong hospital stays, and I'll uncover secret germy hiding places at work. The evidence shows my health and productivity programs make a real dollar and cents difference to an organization's bottom line. Sorry, Jerry, but you've got to go.
Stay safe. Listen to Speak Up and Stay Alive RadiOh. Tune in every Saturday morning. For more information, go to speakupandstayalive.com.